Hello, everybody, to all the participants. Thank you for attending to this session. I'm Abdullah Mbouch, member of the organization team of the event Think Data, and I am really glad to be with you today. Now, we are in the session of Dr. Femi Kuti, CEO of Reliance Health, who will present us the topic how Reliance Health is using data to save life. So, Doctor, you have the floor.
Thank you very much. Perfect. First of all, thank you very much to the BAM2 team for inviting me here today. It's super exciting. I'm coming to you live from Lagos in the middle of some hot protesting happening on the streets. We've taken some time out from the protesting to share a bit about our story on how we're using big data in healthcare and how Reliance Health, we have been working with BAM2 over the last few months, almost since the beginning of this year, to create technology and innovation that we believe is going to be the future of healthcare, not just in Africa, but also across a lot of other countries in the world. And it's my utmost pleasure today, and I feel it's a huge honor to be invited to share that story with everybody here. Merci très beaucoup, as you would say in French. So let's tell you a bit about what we're going to be talking about today. So we're going to be talking about giving you some background about the healthcare system in Nigeria and how it's operating. Tell you a bit about our goals and our mission at Reliance Health and why we do what we do and what we've been trying to achieve. We'll also talk a bit about, I think this will not be complete without sharing a little bit of a story about how we came to know BAM2 and we came to relate with BAM2. And then we'll talk a bit more about the various things that we've been doing step by step and talk about how that has really changed our offering and changed the way that we provide healthcare to a lot of our customers here in Nigeria. So the story of healthcare in Nigeria is not that much different from the story of healthcare in many other African countries. You know, Nigeria is a country with over 200 million people, lots and lots of people. And even though the population is significantly young, we do have a lot of health challenges. And interestingly, the Nigerian healthcare system is reaching a point where we're talking about the double burden of disease. And what that means is, you know, previously in the Western rich countries, you used to have diseases like diabetes, hypertension, obesity, which were diseases that came as a result of the fact that, you know, they're living a good life. They're very well fed, and not so much exercise. There's cars to move around, there's public transportation. So that's kind of the disease you used to see in the Western world. And then at the time in Africa, the diseases that you would see tend to be what we call communicable diseases. So diseases that are infectious, things like tuberculosis, malaria, all those kind of diseases. But now, unfortunately, what we're beginning to see in most developing countries is what we call the double burden. So where a certain class of people, because they are able to get access to good food, because they have cars, because they're living a more sedentary lifestyle, are beginning to get, on one side, the kind of lifestyle, non-communicable diseases that you see in the Western world. So hypertension is on the increase, diabetes is on the increase, strokes are on the increase among that class, while at the same time, we are also facing the burden of communicable diseases like malaria as well. And then very lately, we're beginning to see even more what we're now calling pandemics. I mean, we're all very familiar with COVID, where that's the reason why, you know, I'm not in a hotel in Senegal giving this conference, and I'm doing this via Zoom in Lagos because of the COVID pandemic. And that's also something that has been happening very recently. We've had the SARS pandemic, we've had Ebola, and so we're coming into a world where healthcare is becoming increasing as people. But unfortunately, in most developing countries, the healthcare system is also significantly underfunded because most of it is coming from the public sector. And like most things in the public sector, there isn't enough money for most poor countries to be able to fund healthcare. Another added problem is, again, like many things in the public sector, there are a lot of inefficiencies. You know, data isn't gathered properly. A lot of things are still done by paper. There's not that much storage. I remember very clearly when I was a medical student in a town called Ife, and part of my job as a medical student was to retrieve files. And I wasn't a file clerk, you know, but I was essentially doing the work of a file clerk. And I would have to go into the record section where they would have piles and piles and piles of cabinets, and I would have to pull them out. And then sometimes you would have a patient who hadn't come to the hospital for say 15, 20 years. And the files would be there. But the moment you open the file and you pick up the paper, it's almost like, you know, when you talk about Marvel Universe, where the protagonist does like this and everything disappears. That's exactly what would happen with the file. We would pick it up, and because it had been there for so long, that medical detail, medical information for that person. And that's not a strange story. It happens a lot with a lot of across the healthcare landscape. And of the reason why that is a problem is because there's so much information that helps us, not just from an individual basis, but also from a population basis. You know, that is information that potentially could have given us insights into how to cure disease. It could have been information that could have given us insights into how we can prevent the spread of disease as well, which unfortunately is all lost. Another big problem is, as I said, is, you know, poor funding. You know, since 2008 to 2012, only on average, about 7.2% of the total government expenditure has gone to healthcare. That means that for every $100 that the government of Nigeria makes or receives, only $7 is spent on the health of people. It's fascinating and depressing. And the other thing that makes it a bit more complicated is the fact that primary care, which is the first care that you receive. So if you're somebody and you know you have chest pain, you have a headache, you have fever, the first doctor that you see is a primary care doctor. Ideally, that should be among the cheapest parts of healthcare because it's very common, we can get economies of scale. But for most countries, including Nigeria, it's among the most expensive. It's a very, very expensive piece of care. Now, the reason why that is a problem is because when that care becomes expensive, fewer people are accessing the care. So it's just like saying you want to get a mobile phone, you know. If you remember the very early days of mobile phones, you know, in the late 90s, early 2000s, when mobile phones came out. I remember then my dad bought a cell phone, and the average cost of just the SIM card, not the cell phone itself, but just the SIM card was almost $200 back then. And we're talking about SIM cards that people get for free today. But what happened was, because SIM cards were so expensive, fewer people had phones. But as the SIM cards became cheaper, a lot more people could now get phones. And it's the same thing in healthcare. Part of the major problem that we have is because primary healthcare, the first point of call, is so expensive, fewer people are going there. And then conditions that could have been very easily treated become worse and worse and more serious, up to the point that maybe something that could have been treated with a pill now has to be treated with more expensive surgery. And so those are the kind of challenges that we're facing in healthcare today. And that's where Reliance comes in. What is our mission? We have a very clear mission, which we've been consistently trying to go for since 2016. And that is, we want to use software, data science, and telemedicine to make healthcare affordable and easy to access to people. What this means is we're using technology in different ways so that they can afford it. The reason why that is important is because if people people can get access to healthcare at a price point that they can pay for, they are more likely to use the healthcare. If people are using the healthcare, it means they are going to hospital. Ultimately, it means healthcare becomes cheaper for everybody. And after that, as healthcare becomes cheaper, more people become healthy. And as more people become healthy, it has a massive economic effect on any country that we're in. A lot of money is lost, a lot of economic activity is lost by virtue of the fact that people fall ill from things like malaria and can't go to work and can't contribute. And so our mission is really to be able to make that a thing of the past and bring out a future where that becomes the past. But of course, we couldn't do this alone. A lot of the things that we wanted to do involved being able to function more efficiently than everybody else who had been working in the space. Because when we came into the space, it was still the same kind of scenario that I described. It was paper records. It was, things moving by files. It was a lot of the information, a lot of the data being locked up and not being able to use to maximally help people. And that's how we actually met, Bamtu. Mohammed, who's a great guy, came to Lagos to talk about a few things. He came with Tano. It was a great conversation, very, very interesting people, told us a lot of interesting stories about Senegal, and essentially just, seduced my co-founder and us to come and work together. But we're very grateful that they did, because at that time we had been thinking about how we could build a data-driven organization and how we could sort of use the data that we were getting access to be able to produce, the kind of healthcare platform that people would be able to make use of, and the kind of healthcare platform that would provide healthcare at a much better, much more efficient, much cheaper price point than people had previously had. And it was great to have a meeting of minds with Mohammed and Tana, and instantly it was clear that we connected, and we were sort of speaking the same language, and it was time for us to sort of work together. There were 4 main areas that we decided that we wanted to do some work together. The first was in building a scalable platform. I think what is very interesting and exciting for me, particularly, and I know that Mohammed has made mention of this before, is the fact that, in the past, it used to be foreign companies working with local companies to create technology or create innovation. But now to have 2 African companies coming together and working to solve a serious African problem, it's exciting. It doesn't happen very often. And when it does, it's something that's so exciting that, sometimes I think about that, wow, we're actually building something that could change the continent. And not just can change the continent, it's something that we could also take to other foreign countries as well. So if you close your eyes and think about that for a second, it's not the story that we hear. The story that we typically hear is of foreign companies working with African companies, or foreign companies building something abroad and bringing it to Africa. But to have the story of 2 African companies working together, building something that could impact another country, to me, it's like one of the most exciting things I've heard in a long time. So one key thing for us was to figure out how to build a scalable platform that we could use across not just 10,000, 20,000, 50,000, 100,000 customers. No, something we could use for millions and millions of customers across multiple countries. The second big thing was to be able to have a central store of data where all the disparate data pieces that we're receiving from various other places could be locked in one place, making it easy for us to process and access and analyze. The third part was on process automation. One of the biggest cost items after healthcare expenses for a company like us is the process of administering the healthcare. So when I talk about administering healthcare, I'm talking about customer support. I'm talking about onboarding. I'm talking about people filling out forms. All those processes are quite costly because they involve people doing manual processes. And so our focus was, how can we automate those and pass on those savings to our customers? The last piece was a focus on building a data-backed a data-backed decision-making organization or a data-driven organization? And what are the tools that we needed for us to be able to build that kind of organization? And so for the rest of this, I will talk about the way we sort of work to build this and bring this into fruition. So talking about the Scalable platform, as I said, the focus for us was to build a fully digitized healthcare management, healthcare administrative system from end to end that could scale across multiple countries. And doing that required for us a different way of thinking about how to build our products. It required for us a different way of thinking about how to structure the technology, sometimes, in fact, even at a point, how to structure our technology team to be able to provide that. But the main focus areas were, if we look at the various pieces of our technology that we use in multiple locations, which of those do we have to build scalably? So we're talking about things like, how do we build our sign-up process to be able to support the sign-up and onboarding of millions of people? How do we build the onboarding of our providers in such a way that the healthcare clinics, the healthcare hospitals, other healthcare providers that work with us could be signed up on our platform very, very efficiently, and on like that. And more importantly, how can we take all that information and be able to access them and be able to pipeline them into a central storage space? The other thing that we did was about data integration. As a company like ours, like almost any other healthcare organization, you're receiving healthcare information from so many different places. So we're getting health information from hospitals that are filing claims. We're getting health information from patients who are uploading test results. We're getting health information from diagnostic labs that are sending us healthcare information. We're getting information from clients, that's companies that sign up with us, who are providing us with the actual data points or the actual employee data for people who they want to sign up. So all those various different pieces of information that are coming in from various sources needed to be sort of locked into a central place. And we did a lot of work with Bamto and essentially built out our instance on Snowflake and AWS. We sort of served as a central database storage system for us, where everything could sort of come into and sit. The reason why this was important is the moment we had all the data in one place, we could essentially start accessing it in different ways. We could then begin to build links between it, because the beautiful thing about data is that everything is connected, but you can't see those connections if you don't have the data together in a single place. So when you have data here, you have it here, and you can't see them link, it sort of reduces the value of that data. But when you have them next to each other or on top of each other or right beside each other, you can create those links. That's when insights begin to happen. And that's when real magic begins to happen. The next thing that we did was a lot of process automation. As I said earlier, a lot of our processes were quite manual, not just because essentially that's how it works in the industry. So to give you an example, one of the companies that we signed up was a company that involved almost 10,000 individuals. And even though we had built a system that allowed people to sign up for their healthcare via an app by filling out a simple form, a lot of the people who worked in this organization didn't have smartphones. So they still needed to, fill out pieces of paper. And essentially for us, what happened was we ended up in a situation where we had almost 10,000 piles of paper, 10,000 pieces of paper piled up that we needed to scan and process and type to turn that data from paper into our digitized system. And I think it was that point that we discovered that, look, this isn't going to be the only time that we have this kind of issue. And we can't every time afford to hire, hundreds of people to, manually convert these forms into physical forms for us. And so that's kind of like what we started thinking about, OCR for things like sign-up forms. There was an interesting conversation with Bamtu when we started talking about OCR for sign-up forms. The next thing we started thinking about was, what else could we use OCR for? And then we started looking at OCR for diagnostic reports, where we were going to be able to receive diagnostic reports, take out the information, and then store them digitally. The reason why that is so powerful is because not only is it a key competitive advantage, it's also a way to prevent mistakes. So one major cause of accidents as well as waste in healthcare is medical records mistakes. A lot of those mistakes happen when people are converting physical records into digitized records. Because of course, if you're giving a pile of 500 pieces of paper and you keep typing them every day, at some point, you're going to get tired and you want to go and watch Game of Thrones, or you want to watch something else on TV, and you will then begin to start thinking about the Game of Thrones you want to watch, and potentially, if the name is Khalid, you might end up typing Khaleesi, and that would end up being a mistake in the digitized system. So the advantage of things like the technology that we build is that it helps us reduce the mistakes that could potentially affect the patients. Another big thing that we did was around claims automation. So one big part of our job is when our customers go to the hospital and they see a doctor, the hospital send us an invoice for that treatment, and we agree to pay them at a pre-established price. Now, sometimes what might happen is because the hospitals are dealing with so many different potential healthcare providers, they could make a mistake in entering the amounts. There's the potential for fraud in potentially sending invoices for people who didn't go to healthcare. So what we did with a lot of the claims automation that we did was to be able to build a process where in the past, this needed to be done physically by human beings. But now with the systems that we built, we can essentially put them through rule-based engines as well as machine learning algorithms to be able to automate that process and reducing the setup that's required for that. To give you an idea, the biggest player in our space in Nigeria actually has a team of almost 30 people processing claims on a daily basis, 30 people sitting in an office. And now what gets more interesting is the fact that because of these 30 people processing claims, it takes them typically at the fastest about 2 months from receiving an invoice from a hospital to paying out the invoice. In our own case, the kind of technology that we've built with the help of data science and the help and support of BAM2 is going to allow us to do the same type of work in seconds using 2 to 3 people at the most. It's just mind-blowing, the extent to which we could sort of use and escalate that innovation that we're building. There are a lot of other things that we had in the mix. We're doing a lot of stuff around, customer support, where we're automating emails. There's also stuff about standardizing a lot of the healthcare information that we receive. But this is really a big deal because a lot of the cost, as I said, in providing healthcare comes in this area, in the area of, receiving information, cleaning it, just administration generally. And if you can take away that big aspect of that cost, it's such a big cost driver that the effects are so positive that you can pass on those cost savings. This is actually one of the big steps in making healthcare cheaper and more affordable for as many people as possible. Saying one big thing that we're trying to do is to build what we call a data-driven organization. And that is an organization where decisions are made not on guts, not on feelings, and not because the most senior person says this is what needs to be done. Instead, our focus is on building an organization where it's data that drives the decisions that we're making. But it's difficult to do that if you don't provide the tools that people need to be able to actually get the insights from the data. So what we've been doing is we've been building a lot of capacity around the use of Tableau for very deep data insights, as well as building capacity around the use of Metabase for general company insights. But I think the most important things for us is the fact that across the company, it's not just a data team or a data department or an analytics team or the business intelligence team that is focused on using data. Instead, our focus has been on making sure that as many people within the organization have access to these data platforms to be able to make these data-backed decisions. And now we're actually moving to a step where we're doing a company-wide training for everybody on how to use simple data analysis tools like Metabase. One key thing that we do is we use Metabase for the visualization of everybody's key performance indicators. And I think another thing that's important is we've taken on a charter as a data open company. So what that means is we no longer have data in different silos. So it's not like the provider team has their own provider data. The analytics or the underwriting team has their own underwriting data. Everybody, regardless of your team, has access to all the data in the company, except very, very high level, very high level information that need to sort of be protected. Of course, at the end of the day, all of this is to get to a particular endpoint. So how has this worked for us? One key thing is that our company is now extremely efficient in how we manage data. What this means is the process of receiving data and storing data is now very simple. It's very clean. It's very consistent. The quality of the data, when we now constantly think about the quality of the data that we're receiving and how to store that data, because we know at the end of the day that the quality of data that we have is what is going to make it easier for us to derive insights and benefits from that data. Generally, in terms of our operations, super efficient now. As I said before, we used to have an army of people who would convert these written documents from new clients into physical ones. Now we very rarely need that. We can start phasing that out. And the advantage of that is the process from receiving forms to processing forms begins to compress. When we're talking about our claims automation system, where, you know, as we're scaling, we are not scaling our team with that same size. To be able to like accommodate or respond to the data or the information that we need, the administrative tasks that need to be processed as we scale the number of customers that we have. I'd say, again, another key benefit for us has been improved decision making. I think one person that has been blown away is the person who runs our clinic, who constantly comes back and says, I was looking into the data. I never knew that this is what is happening in our clinic establishment. Or, you know, the brilliant man who runs our underwriting team, who comes back and says, wow, I always had this assumption about the usage of this particular condition by our customers, only to look in there and discover that it's something completely different. So the benefits are so clear because we're moving into a setup where everybody is more focused on looking at the data and not using just their gut to make decisions. And at the end of the day, the decisions that you make based on cold, hard, raw facts that you have are significantly better than those that you make from just hunch or guesses. Now, the key most important thing across all of this, we're only in business, we only do what we do for our customers. Because the most important thing to us is that our customers have better healthcare. The most important thing to us is that our customers are satisfied. The most important thing to us is that our customers are healthy. And a lot of these data points allow us to be able to do that in a way that's cost effective. It allows us to be able to see trends in terms of things that even our customers might not know. It allows us to be able to serve our customers in a more efficient way. It allows us to take those gains that we have in efficiency and give it to our customers in the form of a cheaper health plan or in the form of cheaper services that they can now find more affordable and ultimately makes them healthier. So that's essentially our story. I think the big conclusion for us is data and the technology that we can use for data definitely has a big part to play in the provision of healthcare delivery and in making sure that that process is seamless and in making sure that having that better healthcare delivery backed by big data creates a society that's significantly healthier. You know, the technology is out there, the technology is available, and I think it's time that a lot more organizations began to use this technology and to leverage it. Because at this point, it's not just about using the technology for the sake of technology. We're in the middle of a pandemic now. So many people have lost their lives. A lot of people have become sick. And I think the biggest fear when this pandemic started was, is Africa ready to face the outcomes? Thankfully for us, the effects were not as severe as were expected. But did we miss a bullet? Did we dodge a bullet? We don't know when the next pandemic will come from. And we need to be prepared to build a stronger healthcare system, a stronger healthcare infrastructure that makes use of data to make key decisions to keep our people healthier. We need to be prepared in case there is another pandemic that comes our way. We need to be prepared to be able to fight it. Even outside pandemics, we need to be prepared to be able to fight the daily conditions that we see of malaria, diarrhea, hypertension, heart failure, strokes, heart attacks that we see on a daily basis. The information is there. We have the data, but how are we using it? And that's the key question that I think I would want everybody to walk away with today. And if in some way you can find somebody, you know, who makes use of, who works in the healthcare space, it's no longer a business decision. This is about our lives. And we need to begin to find ways to start using the data that we have to create a healthier society. Thank you very much to everybody for your time. I would love to take any questions that people might have. I can see it. So I have a question here from Cedric Sadio. And his question is, the platform on which people have to fill their information already has predefined disease characteristics, or is it the patients who fill it? That's a really great question. Essentially, the way our system works is, what we've discovered is there are a lot of different names for the same condition. So the system that we've built essentially can sort of take those different names and then connect it to a standardized format. So the example that I always like to give is paracetamol. So in Nigeria, paracetamol has different names. Some people might call it PMOL, some people might call it PCM, some people might call it paracetamol. So the way we set up the system is that regardless of what name you know it by, we already have a backend standardization that allows us to take those names and standardize it to paracetamol. The reason why that is important is because our belief in terms of technology is not to make the user do more work. So our focus is, if the user already knows this condition by X, let them continue to call it that. But on the back end, we're able to clean that data and standardize it regardless of what the patient is using, what the customer is using on the front end. And so that's essentially how we handle like disease characteristics. So people can put in what they feel, what they know as the name, but we can always map it to the standardized name on the back end, which allows us to keep our data clean. Okay, there's another one from an anonymous person. Which machine learning model do you use most? Thanks for the question. Unfortunately, I don't know. I don't know the mechanics of how it works, and I'm glad that like Mohammed has turned on his video. So it looks like he's interested in the question.
Thank you.
So my job is just to provide multiple context.
You know what? I'm pretty sure that you can give answer for this question. Now you are a real data scientist. So
I don't want to say the wrong thing.
Great. Thank you for the anonym. So we are using a lot of type of learning models. So we use deep learning models. We use supervised and unsupervised models. So depending, we have a lot of use cases working with Reliance. So yeah, we are using also classification, linear regression. So we are using a lot of let's say kind of models. And so waiting the next question. So yeah, Femi, really thank you very much. So it was so full of inspiration. So I'm about to ask you, are you free for being a CEO of Adbantu? because I think you can tell data and AI stuff much more than me. So
I'm pretty sure you're doing a much better job at BAMTU than I would ever be able to do.
No, honestly, so
I will actually decline.
no, it's why we wanted you to join the conference to share your vision of data. I used to travel a lot in the continent and across also other continents, but your vision of data and what data can bring to you, it's something very rare. So again, congratulations. So your talk was really amazing. So full of information, I think. And yeah, and the key things I keep here is when African company work together. So we can work on very new or innovative things between African companies, and it's what we are doing here. So yeah, data is a new oil, and as African companies, we need to take care of this. And I'm sure we are talking about BAMTU here, but a lot of other companies in Africa which can help any company to take the most important values around data and AI. So yeah, it's just amazing the way Reliance is using data, and it's really an honor for BAMTU to work with you on this project. So thank you again, thank you very much, Tony. So it was just yeah, amazing, like a listening story, and it was a story. Thank you.
Thank you very much. It was an honor to be here. I'm very grateful for the invitation. Thank you very much.
You're welcome.